Those committee members are Amobian, Freeman, Baylor, Neal, and Holland. We do have all members present except for Councilman Freeman. Councilman Neal is here. He just is not connected to video at the moment. Whenever you're ready to get started, Madam Chair.
Okay. Therefore, we've had roll call, so everyone is present except Mr. Freeman.
Correct.
We certainly want to express our condolences for the loss of his father. So with that said, may I have approval for the minutes of our last meeting, please?
So moved. Second.
Been moved and seconded. All in favor?
Aye.
Aye. Thank you very much. We have one piece coming before us today. It's a resolution declaring the month of April 2022 Minority Health Month in the city of Akron to raise awareness about health disparities that continue to affect racial and ethnic minority populations, and encourage action through health education, early detection, and control of disease complications, and declaring an emergency. Before we get started with input, I would certainly like to have my name added to this. I don't know, is anyone present? I tried to reach Ms. Tamika Rose. I didn't get a response. Is she present, Madam Clerk?
Yes, she is.
Hello, Councilwoman Amobian. How are you?
How are you?
I'm good. How are you? We are bringing this we wanted to say thank you, and I apologize you couldn't get me. I've been running around the office today, so I really apologize.
Okay, that's fine. Just want you to just talk to us about what's going on. I know we have several initiatives going on, infant mortality, and I know that's been progressing. Mm-hmm. And I don't know if the health department has given us any numbers on how we're doing with the COVID-19 vaccinations for the minority population or not. Do we have any current data on that?
I don't, but I do have someone here with me from the from Summit County Public Health at the time, Vanessa.
For whatever reason, I can't see you. I can see Councilwoman Baylor, but I don't see, let's see if I can do my, it's probably me not doing.
Madam Chair, if you go to gallery view, you should see a video that says Chambers.
Yeah, I got it.
That's us here.
Please move forward.
Hello, hi. I'm from the Health Department, Summit County Public Health. My name is Vanessa Williman. I am the director for the local health department, the local Office of Minority Health. And we are having 3 events in April for Minority Health Month. The first one is a virtual cooking class. This Friday, we have 74 participants. We are, gathering information and providing nutritional information during those cooking classes, as well as doing quick and easy meals that young adults as well as older adults that is very low in time are able to complete. And then we have our Minority Health Fair at the end of the month, where we have vendors from all over. We even have Ohio State's Cancer Center there to do screenings, to do breast screenings for minority women. We have a lot of local organizations. Canopy is going to be there providing education and resources, and that's April 27th at the Metro bus station.
Councilwoman Amobian and other council members, we will get the numbers for the COVID-19 vaccination rate from the health department and send them over to council later this week. But in addition to our work around infant mortality, violence prevention, and declaring racism as a public health crisis, I would just like to take a moment to speak to the committee around a crisis that the African American community sometimes overlooks, and I wanted to bring this attention to the attention of the community, especially the African American community, that mental health is often overlooked as a key component of overall physical health and well-being. And Summit County has experienced an increase in deaths of despair, particularly in the African American community. And minority populations have historically faced barriers to health and wellness services, and current cultural climates, along with racial boundaries, further complicate the attitudes about the access to support and services in Akron and Summit County. And I just wanted to take that time to publicly speak to that, the importance of mental health in the African American community during African American Health Month here in Akron.
Well, thank you very much for that. I would hope that we could reach out to Amy Wade, the Executive Director of the ADA Board, the Alcohol, Drug Addiction and Mental Health Services Board, and if we could reach out to the Minority Behavioral Health Agency on Copley Road. Perhaps they can come to council and give us some type of update during this month in terms of what they're seeing. There's also the Urban Health Prevention. I'm not really sure if we interact much with that agency, but certainly I know that Yvonne Cagle and her staff would gladly come and talk to us about what they're seeing in terms of the needs in mental health. Those are three groups that should come before us sometime this month to share with us with what they're seeing and what they're doing, because they're doing some really good work in this community.
Councilwoman, I will work with the clerk to schedule that for you.
Okay, I appreciate that. Are there any questions, any hands raised, Madam Clerk?
Madam Chair, I do see Councilman Malik and Councilwoman Connor have their hands raised here in the chambers.
Okay, any committee members?
I'm sorry, I see that Councilman Neal has his hand raised.
I can't hear you.
Councilman Neal has his hand raised?
And you said Connors and Malik?
Correct.
Okay. And all of these people, I'm trying to remember all the committee members. I know Baylor, Neal, Holland, Freeman, right?
Correct.
Okay. So let's go with Neal first, and then we'll come back to Malik and Connor. Thank you so much.
Thank you, Madam Chair, and thank you, Ms. Rose, for your report. I also want to note that indicators I'm getting from those who work in my community is that opioid overdose is higher in the Black community now than when we sounded the alarm some few years back. Something I'd like to find out, if we could get these numbers, is a lot of times there are grant dollars that are coming in through our health department and our hospitals, county and city, that are related to disparities in the Black and brown community. If we can get a total, I may not have this, but if we can get a total on what those dollars are that are coming in, and kind of get some idea on what the return on those grant dollars are. And I'm talking holistically, from infant mortality to be it with diabetes, whatever folks are applying for grants. So we can work to do a more holistic approach. I'm very appreciative of when Minority Leader Sykes brought the dollars in for infant mortality, that she didn't go the traditional route. And because of that, the Zika House and some other things have been established. Non-traditional ways of engaging that have been adopted by the community and have really taken hold. But I'd like to know what other dollars are coming in and if we're missing something, so that we can make sure that we are servicing the community as best as possible. And especially making sure that we engage those who are on the ground floor doing the work, but may not have the technical staff to always apply for the grants, that we have them partnering with our traditional institutions to make sure that we capitalize on that, please.
Good afternoon, everyone, and thank you so much for that input. I'm Shalita Smith here, and I'm the Director of Family Health at Summit County Public Health. So my job is I oversee grant services, outreach, and strategic initiatives from cradle to grave. So a lot of the things that you're talking about fall under my bandwidth. And I would have to agree, Councilman Neal, that we are seeing a rise in the opioid epidemic in the minority population, and that is something that we are addressing at the health department. And I would love to talk to you more about your particular ward and what you're seeing. So one of the things that we are looking into doing is reaching out to some of our local churches and community leaders in the minority population, because we need to figure out a way to get the information out there. And I do also want to state that at the Metro Transit Center, we will be having some of our team that focuses on harm reduction at that event. We will be passing out Narcan kits as well as other resources in the community around things that are happening. And then also to Councilwoman Amobian, in terms of your conversation around COVID, we have had a huge decline in our COVID cases in our community, but as you may or may not saw in the press release, we are starting to do some drive-through clinics again tomorrow. So we will also be having COVID vaccinations, hopefully at the transit center. So it will be another opportunity for individuals to get vaccinated and to spread that education. But I will make sure that we get that those numbers to you guys, and any other information that you're interested in, we can definitely do a little report for you.
Thank you very much for that. I couldn't hear. Did you say we're seeing a rise in COVID vaccinations in minority communities or not? I couldn't hear that.
I'm sorry, say it again.
Are we seeing more minorities get the COVID vaccinations or not?
I'm not exactly sure as far as the minority community, but we can definitely run those numbers, but just know that we are continuously doing outreach, and we actually got some additional dollars from the Office of Minority Health through the CDC to do some extended outreach. So we are actually in conversations with the Urban League as well as with our medical director at the health department to figure out the best way of doing so.
Okay, thank you very much. Now we'll go to, I'm not sure who was first, Connors or Malik, but please.
Thank you, Madam Chair. Thank you, Councilman Malik. I just wanted to say that,
Can you speak in the mic?
I just wanted to say thank you to Tamika Rose, Shalita, Vanessa, for the email you sent with the listing of all the events for Minority Health Month. It looks like there's something almost every day, and I will be very happy to share that with my constituents. You're doing a great job, and I'll look forward to seeing you at some of those events. But it was nice to have it all in one listing.
Thank you.
Thank you, and similarly, I want to thank all three of you for your efforts. I know how much hard work goes into it, and as we all know, COVID-19 uncovered, long-standing racial disparities, not just in health, but across all systems, but they're all part of the social determinants of health, and so I appreciate all the continued focus. We can't just forget what we learned during COVID, and I know you all are making sure that we as a community don't forget, so thank you.
Thank you.
Are there any other comments or questions? Madam Clerk.
There are no hands raised here in chambers, Madam Chair.
No, the hands raised just happened?
Correct.
Thank you. That said, may I have a motion to accept the resolution and with a favorable report? And,
Second.
so, thank you very much. All in favor?
Aye.
Oppose? And tonight we will try to do that with council as a whole. I'm sure everyone will be in favor of that. Okay? With no other business coming before the Health and Social Services Committee, I move that we adjourn.
Thank you.
That is the final committee meeting of the day. Council will meet at 7 p.m. tonight. Thank you.
Thank you.